How's it going, guys? So we have a very easy question for mixed farm slash micro. Exceedingly high yield bread and butter, not just for step one, but also for step two. They will show you this on family medicine, expect you to choose the treatment. Obviously, mechanisms of action, very step one-ish. Before we get started, please subscribe to my channel. I really appreciate it. Give the video a like, really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. The link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the clip. 14-year-old boy comes to the physician. 1 week history of a circular rash on his forearm. It's not itchy or painful. Family has 3 dogs at home. Physical examination shows a 1.5 centimeter circular scaling lesion as shown here. This is tinea corporis. This is ringworm. This is a fungal infection and it's caused by dermatophytes. You don't need to know specific organisms. If USMLE asks you an organism, they'll list the only fungus listed. They're that easy about it. History of dogs at home or use of yoga mats at the gym. I mean, classic buzzy vignette descriptors. It may or may not be itchy or painful. Okay, you don't want to pigeonhole yourself into any one description, but very buzzy, very easy so far. So we say, well, how do we treat it? So let's just walk through the answer choices here. We'll go backwards. So in terms of inhibition of the drug, what's it inhibit? Choice C, RNA synthesis, wrong answer. This refers to flucytosine, okay? Very low yield agent. Technically, when we have Cryptococcus neoformans meningitis, we give amphotericin B plus flucytosine, and then the patient will be tapered on fluconazole for about a year. But flucytosine, that's its only use on USMLE, and even still, they don't really ask it. They still want amphotericin B if you're forced to choose a drug for Cryptococcus neoformans. Wrong fucking answer. Choice D, mitosis, wrong answer. It's like, ooh, wow, this refers to microtubules, okay? This is Griseofulvin. They like doing this, okay? So microtubule inhibition, Griseofulvin, really high yield. That's used for oral Griseofulvin for the patient only is used for tinea capitis. That's asked on family medicine, not for patient and classmates or / close contacts, just patient only. Oral Griseofulvin. That's the only specific use of Griseofulvin I've observed across NBME material. Apart from that, just mechanism of action being it's a microtubule inhibitor. Of course, other microtubule inhibitors, not to get crazy tangential, you should be aware of vincristine, vinblastine, as well as colchicine and mebendazole, anti-helminth agent. And then the paclitaxel, docetaxel, those are actually hyperstabilizers. Okay, a lot we can talk about. Next answer, epoxidase, wrong answer. This refers to terbinafine, which inhibits squalene epoxidase, the conversion of squalene to lanosterol. Terbinafine topically is used for tinea pedis, okay, foams or sprays. Oral terbinafine is used for onychomycosis, fungal infection of the nail beds, okay? Wrong fucking answer. Choice B, demethylation is the correct answer. Okay, so we treat ringworm, tinea corporis, with topical azoles, clotrimazole / miconazole. And USMLE wants you to know, they asked this on the new step 1 forms. They want you to know azoles inhibit P450 mediated demethylation. Okay, so you'll get a question where it's just easy like this, and they might want, for instance, fluconazole is the answer. And then the correct answer will just be P450 mediated demethylation reaction. Every fucking student gets it wrong, right? They're like, what the fuck? It's not hard. I mean, it's just the conversion of lanosterol to ergosterol is via an enzyme called 14-alpha demethylase, okay? And it's P450 mediated, all right? Bread and butter, very buzzy. And there's a myriad of uses for azoles. We can do a 17-minute oral presentation on azoles right now. I'm going to stay consolidated. Choice A, carbohydrate synthesis, wrong answer. This refers to echinocandins, okay, caspofungin, mycofungin. They inhibit beta-1,3 glucan synthase, okay, carbohydrate cell wall synthesis, all right? Whereas in contrast, ergosterol is the fungal cell equivalent of cholesterol, which is cell membrane instead, okay? Amphotericin B, nystatin, they poke holes in the ergosterol membrane. Carbohydrate synthesis, 1,3 beta-glucan synthase, cell wall, okay, caspofungin, mycofungin. USMLE is not going to obsess over specific uses for those, but they can technically be used for invasive aspergillosis, candidemia. But in general, amphotericin B is the go-to agent for systemic / disseminated fungal infections. All right. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.